You want to go ahead and start the recording? All right, good morning, everyone. My name is Alisa, LaPolt, and I'm the Policy and Advocacy Director for NAMI Tennessee. Thanks for being here today. If you're joining us from Middle Tennessee, I hope you're staying warm. And if you're joining us from other parts of the country, as we do have registrants from other part, welcome to NAMI, and we hope that you enjoy this session. This is one of 5 sessions in a month-long series called Days on the Hill. Typically, we have a one-day event at the Capitol, but because of current events, there are no Days on the Hill taking place. So we decided to spread it over several days and create several opportunities for you all to participate. So thanks for being here. We do want to start out with a quick poll, and this is a poll regarding your affiliation with NAMI. We have several people who are new to NAMI, several people who registered that are not members, and we just wanted to see what the relationship is with you and NAMI Tennessee. So if you could just click on the poll.
Don't know how to do that.
If you have your computer mouse, you can do it that way.
Tried. I can't.
Folks who are calling in on telephone only will not be able to do that.
Oh, yes. Okay. Thank you. Thank you for that, Roger. Okay. And as we're just watching that poll, I'm going to introduce Jeff Fladen. Jeff Fladen is the Executive Director of NAMI Tennessee, and he's going to give us a welcome. Thanks, Jeff.
Thank you, Alisa. Thank you all for being here. And I'm substituting for Alan Bartles, is our board president. He's having surgery today, so we wish him a successful outcome and a speedy recovery. And absolutely, yes, I am wearing pants today, just in case anybody wondered there. Yep, there we, no, you can't see it. I tried. I just wanted to see if I could lift my leg up like that, and I wasn't sure if I could do that. But the reason I did this is because it's not so serious, really, to be involved with advocacy. I think a lot of people just, their eyes glaze over. It's like asking people for money. Talking to legislators, I just don't want to do it. And for NAMI, it's so important to have you here because government policy, government decision makers really impact what happens with our mental health system. And we are not in the NAMI world very much, as far as I know, writing very large checks to our congressmen and our senators and our state legislators. So therefore, it has to be people that care about this issue, whether they are living with a mental health condition, whether they're a caregiver, whether they're a provider, whether they're a leader like Commissioner Williams. It's sharing our stories and advocating. So we call this grassroots advocacy, that your voice matters, your story matters. We want to make you more comfortable to do that. And as Alisa said, it's not one day on Down the Hill only. So it's over time. And Alisa has been doing just a tremendous job. We're very fortunate to have her to bring her experience, where she had been a previous NAMI executive director in Florida, but also a lobbyist. And she understands how bills become law and how opinions become policy. And we're fortunate for her to lead us. And you'll continue to see things, the videos, if you miss some, as she mentioned, and also in our emails. We will have calls for action from time to time as various bills come up for review. There's things important to us. I'm not going over that now, but thank you all for being here. Please spread the word, encourage other people that you know to watch the video if they miss, to participate in the other events which are listed on our webpage. And thank you all for allowing me to be here. And am I supposed to, we forgot to cover this part. Am I introducing Commissioner Williams, or are you? Alisa?
I am.
Okay, well, thank
I
you
am.
for allowing me to join with you today.
Thanks. Thanks, Jeff, for being here with us today, and we appreciate your leadership. So next we have Commissioner Marie Williams of the Tennessee Department of Mental Health and Substance Abuse Services. Commissioner Williams has held this position since 2016. She was initially appointed by former Governor Bill Haslam, and then reappointed by our current governor, Governor Bill Lee, back in 2019. She has an extensive background in mental health, behavioral health. The beginning of her career was in Memphis, supporting people experiencing homelessness and mental illness. And she actually started working for the department in the year 2000 as Director of Housing, Planning, and Development. Her initiative, the Creating Homes Initiative, has leveraged $600 million and developed more than 18,000 supportive housing options for people diagnosed with mental illness and co-occurring disorders. She's had several positions in the department. In her previous position as Deputy Commissioner, she served as top advisor to the commissioner and managed the departmental budget of $337 million. She successfully assisted the department's transformation initiative. Through strong partnership and collaboration with community providers, treatment for patients was moved into less restrictive environments, and $20.5 million was reinvested into community-based services. And when you hear her speak, you'll see that that's definitely important to her. Her leadership secured support of 3 East Tennessee private psychiatric inpatient hospital partners to provide services to those patients previously served by Lakeshore Mental Health Institute. So she has also a background in the area of criminal justice reform, advocating increasing funding and expanding the network of recovery courts to encompass 78 of those courts throughout the state. And she's responsible for the leadership and oversight of the department's new juvenile justice program, which seeks to create alternatives to out-of-home placements in areas of the state where options are limited. So that's just a brief overview. And Commissioner, we are so honored to have you here with us today. Thank you.
Thank you so much, Alisa. And thank you to everyone that has joined today. NAMI is such an incredible agency for our state, such an incredible leader. I cannot say enough about Jeff's leadership, how he is so willing to collaborate with our department and with others across the state. I love that Jeff is constantly sending us information that can make us better in our department. And I also just truly see Jeff as a friend. He cares about what is happening in this state for individuals that are struggling with mental health issues and substance use issues. The other person that's part of your team, Alisa, that I really appreciate, who I saw on here earlier, is Roger Stewart, who has been a long time partner with our department. Roger, thanks for all you do. And Alisa, we so appreciate that you joined the team here in Tennessee. Know that you're going to make a difference for this state. Love your background because the things that Jeff spoke about in the beginning related to policy and decisions and funding, y'all's voices matter. So anyone that has a story to tell is an advocate. And I sort of think about it that way, Jeff. It's what's your story? Your story speaks volumes, and our legislators and our governor truly care about those stories. And you can see in their actions that they care. I'll be talking some about the funding that's been added over the last 2 to 3 years. So look forward to talking about that. As you can see behind me, I have snow behind me, and I love starting with a song. So what I will do is start with this song that's apropos for today, and hope you guys enjoy it.
But the fire is so delightful Since we've no place to go, let it snow, let it snow, let it snow. Shows no sign.
So I'm enjoying the snow, and I hope everyone else is. I'm also enjoying the ability to do work in the snow through technology. So as I said, we're very excited about being here today. On the Zoom our incredible staff, and I'd like to just say huge thanks to Lisa Reagan. She leads our consumer affairs staff and does such an awesome job in that role, and she leads our peer support efforts. She is a huge, huge addition to the state. With her, Gerald Pitts and Kathy Haley, as well as Michelle Webster. I would like everyone to know that our Consumer Affairs office is open Monday through Friday, and you can Google us and be able to call in if you have any need to help a consumer, whether it's a family member, whether it's yourself. If there are things that you need that are not working for you in your service delivery system, please call them. That's what they're there for, and they take many calls during the year. And then, of course, Rob Cotterman, who serves as our Assistant Commissioner of Mental Health Services. He's doing a fantastic job in that, as is Matt Yancey, who is our Deputy Commissioner. We are very blessed in the state to have an incredible team, Alisa, which is why all of the things that we've done is really a testament to the team. So thank you for that. I've been asked to talk a little bit about advocacy as well as what we've been doing in our department to give you an update on that. And I can tell you a lot has happened over the last several years. In 2020, as you guys know, as we started towards the beginning of last year, our providers turned on a dime to be able to serve individuals in our communities through telehealth. The legislature and the governor allowed us to expand telehealth capabilities so we could do calls with individuals, as well as do any kind of tele-web based. And it has been amazing the number of people that have been outreached through that process as we've been dealing with the COVID pandemic. I want you to know that in addition to that, our state hospitals stayed open and have continued to stay open. Ty Thornton, who's our chief of staff, as well as our deputy over the hospitals, has done a fantastic job with each of the CEOs to ensure safety for patients that have come into our hospitals, as well as to serve individuals in our hospitals. We know that the pandemic has placed a whole lot of stress on youth. And to that end, we have been very lucky in that the governor and the legislature last year set aside a pair of programs to serve youth that had just started. We had funding that created the behavioral health safety net for children so that any child in this state is able to get mental health service delivery if they're uninsured or underinsured. Please, if you hear someone that needs help and they say, I can't get help because I'm uninsured, our providers, our mental health providers across the state every day serve uninsured individuals through the safety net, both kids and adults. Last year, they served almost 40,000 Tennesseans uninsured with incredibly important mental health services ranging from care coordination to therapy, to med management, to transportation, a multiple array of services. And so we're very lucky to have kids added to that ability to provide those services. The other thing that the governor added and the legislature approved that we've been very excited about is the school-based behavioral health liaison program. This has allowed us to now have a school-based behavioral health liaison in all 95 counties. These are master's prepared individuals who work directly with youth in those school systems. So we got to expand that so that we have one in every county. We're very hopeful this year that the governor will allow us and the legislature will allow us the ability to expand that. The governor has put more money in his budget to expand kids' services through the safety net. In 2020, I want you to be aware that our staff wrote almost $114 million in new federal grants. These grants allowed us to respond to the pandemic. They allowed us to respond to children who were at need and at risk of being placed in state custody, and an ongoing response to individuals in our state who have been struggling with opioid abuse and substance use. I can't say enough about this team. I mean, our team works hard. We have very low overhead. We only have 6% overhead. But the fact that they show their commitment every day and go that extra mile to bring in more grants than what we actually get through the state, that's amazing. $114 million that all goes straight to the community. There's a small amount, as I said, 6% overhead that we have. I want you to know that through all of this pandemic, we've learned a lot of lessons. And the biggest lesson has to do with telehealth. In the behavioral health sphere, we've seen firsthand, as I said earlier, the impact that telehealth can have for our people. We know that Governor Lee is committed. He's had a bold vision to reach more Tennesseans and close the gap on behavioral health needs in his budget proposal for the upcoming fiscal year. As I said, he's included $6.5 million to increase safety net services for kids. Some individuals are thinking that that means we're going to increase the behavioral health safety net, but actually we're going to increase safety net type services for kids. That's the focus. He's included additional funding for our statewide mobile crisis teams. Our providers are doing excellent work with individuals 24/7 every day of the year to respond in a mobile crisis way to help individuals. The governor's also put money in for our expanding of the criminal justice liaison program. Many times individuals that are not being able to get treatment either because they don't know about it or they don't seek it. Sometimes those individuals wind up in places that they shouldn't be, and the criminal justice system is a place we do not want people to be in who are struggling with mental health. Criminal justice liaisons actually work in the jails and the community criminal justice area in each community in the state. This will allow us to have one in every county. Again, an unbelievable sending this to scale so that we can reach every Tennessean in every county. The Creating Homes Initiative, which is going to allow us to help individuals access quality, supportive, permanent housing who are struggling with substance use as well as mental health. And the focus there will be those coming out of incarceration. And then our residential recovery program. We're excited because the governor is asking the legislature to let us fund 2 more of those programs, which are incredible. We always appreciate your support in this process. So as advocates, it's really important that you know that the governor proposed no cuts to our budget. That's phenomenal. There are other state agencies that actually have cuts in this year's budget. We do not. We're grateful for that. And we're grateful for what that will allow us to do across the state. When you look at what we're planning for 2021, our motivation for this year is beyond compare. That means equality or nature surpassing all others of the same kind. And we believe that our team and our amazing provider network, as well as you and NAMI, our Consumer Affairs Association, TADIS, TAMHO, the Mental Health Association, all of us together will create a state that continues to provide services and continues to be beyond compare. If you look at us and you compare us to other states and see the incredible array of services we have, you will know that some states don't have mobile crisis teams. Some states don't have crisis stabilization units. Some states don't even have access to hospitals. We have done a really good job in this state to provide services to individuals. Thank you for all that. I'm seeing the messages that are coming in. I really appreciate y'all's kind words. So you want to know how we are going to improve, how we're going to make a better tomorrow for Tennesseans living with mental illness and substance use issues. How we're going to do that is doing it right now. As Jeff said, advocacy, sharing your story. When decision makers, whether it's us at the department or lawmakers in the General Assembly or the governor's office, put a name and a face with an issue, that issue becomes real. When you see a person who's hurting, that gets laid on your heart. When you hear a story that talks about hope and recovery and services that have helped, that continues to propel what we're doing, which is evidence-based in the state to serve Tennesseans. We know that you are here because you want to solve problems and make our state better for individuals that are struggling with mental illness. And we know that our state lawmakers and governor are in the same boat. Your advocacy matters, and it truly has an impact in making Tennessee the best state to live, work, and raise a family. I want to end by thanking everyone who's here and on the Zoom call. I can't see you because they've got things blocked out, but please know how much we appreciate you. Please know that we get up every day to give 150% to make our state better. So again, I will thank Jeff and Alisa and NAMI members for allowing us the time to talk to you briefly. So thank you so much. We hope this is a great event today.
Thank you,
Commissioner,
Commissioner.
can I ask a question real quick before you go on?
Yes, sir. Yeah.
Do you have some advice on how NAMI members can get involved through sharing their stories besides talking to a legislator? Like, can they write the governor and policy and planning councils? What are some ways you can mention?
Absolutely. Thank you for asking that, Jeff. You can write Governor Lee. You can write our legislators. You can write the Planning and Policy Council. Oftentimes when you write and you talk about your story and you talk about the programs and services that have helped you or your loved ones, it really stays with our lawmakers. It really stays with the governor. It puts a name and face behind the numbers that we talk so much about. When I say we served almost 40,000 Tennesseans in the safety net, those are names and faces of individuals that had the behavioral health safety net not been here, they wouldn't have gotten the service. Who knows what would have happened with that person if they could not access medicine, case management, therapy, transportation, wraparound recovery, peer support. I mean, think about that, 40,000 Tennesseans. Now, I know one thing, Jeff, sometimes we get caught up in the anecdotes. There are people that fall through the cracks. That happens. But I would please urge everyone on this Zoom today, if you have an issue with a person, call our office, call Consumer Affairs. I promise you, we will get it resolved. We get things resolved all the time. Don't be that person that stands aside and throws stones. Be the person that waits to throw the stone until you've really tried to assist and find out what's going on. I can't tell you the number of things that we intervene in where people think they don't have Tenncare, but they do. And because they called us, we were able to let them know that and get them hooked up with their local provider. So please, please, please understand your advocacy matters. Stories of hope matter. Stories where you're struggling matter. But also with that message, Jeff, is an accountability that I really ask people to do is don't spend your time in anecdotes. Get the facts to the department. Get the facts to Tenncare. I promise you, we will respond. We always do. So thanks for asking that, Jeff. And I'm willing to answer I've got time. So if there's anybody else that wants to ask me a question or anything, I've got time, Jeff, to respond.
Yes, and we also have some time on our end as well. So
Okay.
this is a great opportunity. If you want to put some questions in the chat box, that would be a great way to get some questions to the commissioner. I do have one observation, Commissioner Williams, about our
Yes.
governor.
Yes.
Maybe you can speak to this. When it comes to advocacy, I have found Governor Lee to be surprisingly open for a person in his position about his family's struggle with mental illness. He's spoken about his daughter's struggles, and
Right.
you want to speak to that a little bit?
Absolutely. And I want to say also, Mary Sims, I just got your message. Hey, sweetie, and I can see you. And Jane Baxter, I see you. It's so good to see you, Jane. I'm looking to see if there are other people that I see that I can say, hey, Bill Dobbins, was just looking to see Tom Schultz. Anyway, Marion Bacon. I see Mary. Hey, Marion. So good to see you. And I see that Marina Kay has texted in. I'm sorry I didn't see you, Marina Kay. I only have certain things up here. So absolutely, Alisa, I'd love to speak to the governor and what he's spoken about in his family. He's written a book also where this is in his book. And that's one of the things that we are so fortunate to have in this state. He has spoken very openly and honestly about the death of his wife and how that impacted his daughter, who had attempted suicide. And he talks about how hard those days were, but he also talked about how with the services that were delivered, how much his daughter's life changed. So he truly is a believer in supports, recovery, and the hope and the real movement that comes when individuals are able to get the help they need. So yeah, that's a wonderful thing to ask me to speak about, Alisa.
Are there any other questions? Because I do have another one. I have noticed in working in Tennessee, so I came from working 20 years in Florida, where legislators, quite honestly, have not been as accessible. Agency and department heads such as yourself have been very far removed from the citizens of the state. And so when I moved back to Tennessee, I was very happy to see the accessibility. And oftentimes I find when I work with advocates, they're a bit intimidated to work with legislators. They think they're in a different category of people. And, can you speak a little bit to how legislators are people, for the most part, just like the rest of us?
Absolutely. Legislators absolutely are just human beings like all of us. They just happen to have gotten elected to a service. And I will tell you, in our state, our legislators really do see themselves as public servants. And I appreciate that you've spoken to that, Alisa. They are approachable. Our lieutenant governor, as well as the speaker, they are willing to listen and provide support where they can. So it's very important to know we're all people, doing the very best we can. And I really hope people will understand that your story matters, and to believe in yourself and believe in the things that you want to see happen in our state. So I would think anybody that would like to speak to their own legislator in your community, just Google who that person is and reach out to them so that you can share your story. There was someone, Alisa, that had a statement in here that they hope that they'll see the day that mentally ill people are not dying on the streets. I really appreciate your putting that out there so that I can say a couple things to you. Our state has a program that's called Project Assistance to Transitioning Homeless Individuals. It's a homeless program. that does outreach to homeless individuals who then can get into our provider network and get services, whether they're uninsured or have Tenncare. Oftentimes we give up hope on individuals because we think, wow, they don't have insurance. Again, 40,000 Tennesseans were served last year, and we're on par to serve more than 40,000 this year. Please Google our PATH, PATH program, and you'll see who the provider is in your region. And if there are homeless individuals that you know about and you believe that they're struggling with mental health issues, they will go out and check on that person. And I can tell you, Rob Cotterman assisted me, as did one of the providers, about 2 months ago. I'd gotten a call from a concerned citizen about a homeless individual that was staying on the same bench near a McDonald's here in Nashville. We were able to get the mobile team out there. The mobile team worked with that lady. They got her into services. She's getting signed up or already had, I can't remember, she either is getting signed up for Tenncare, already had it, but she got the help she needed, so she wasn't an individual that fell through the cracks. Again, please reach out, and we will do everything we can for those individuals that you know about, that we can get people out to talk to. So thank you for that.
Thanks. So we have a question from Alex. Over half of the women I support are married to or dating men who do not qualify for insurance. I think I heard safety net mentioned, which also does not provide care for these men. Am I missing something? Can you provide?
You are, Alex, you're missing something, sweetie. Are you the lady that has on the glasses and a little thing? All right, Alex, we have the behavioral health safety net serves any uninsured Tennessean under 138% of federal poverty level or below, male or female. We don't care. So if you will Google behavioral health safety net, state of Tennessee, you will come up to our webpage, and you could actually just Google the Tennessee Department of Mental Health and Substance Abuse Services, and then look for the behavioral health safety net. We have a graphic that you can type on, and you'll see who's your provider in your community. And I would encourage you to reach out and talk with them so that you can find out how they're doing intakes on the safety net. I can't tell you how proud I am of the safety net. I worked with homeless individuals in Memphis, Tennessee, and I was actually a PATH case manager myself. And so when we were designing the safety net, Alex, one of the things that we wanted to do is to make it as simple as possible to serve an individual. So it's a one-page form. It's so simple. It is web-based. It is immediate. The person gets the service immediately that they get into that provider. And then what we do that we're really proud of is, instead of asking that individual who's in a mental health crisis typically to start giving us their social security card and all that stuff, we actually allow the provider an amount of time to get all that, so that when we come in and monitor it, they're not feeling like they have to have it then to do the service. I mean, I can't tell you how our providers stepped up to the plate for uninsured individuals to serve them, and how our department has gone out of the way to cut out the red tape. One page is not red tape. So anyway, I'm really proud, as you can tell, about what we're doing. So Alex, please reach out. We serve men and women.
Okay, and Allison wanted to know about mental health providers in distressed counties. What can we do to advocate or help with this? That's a big issue.
Can you say more? What can we do to help with this for the mental health providers in distressed counties? What is it that we're looking to help with?
I know that the workforce issue has been a really big one statewide, with the shortage of mental health providers.
Okay.
I know, yeah, and
All
I know. Yeah.
Got it. All right, I'll come to that in just a minute. When Alex, you asked if it covers MAT services, the behavioral health safety net does not. But our substance abuse team has what's called the Continuum of Care Services, as well as the SOAR program, where we do fund MAT services for uninsured individuals. Just look on our website. It's a very user-friendly website. I'm able to use it, which means it's user-friendly because I am in no way a technocrat. So anyway, please go there. And if you can't get what you need, call our Consumer Affairs office and they will for sure help you know what's available. That's what they're there for. All right, to the next question about the workforce shortage. Guys, we are experiencing workforce shortages across all of healthcare. What's been interesting is mental health providers and workforce shortage has not hit as hard until the last year to 2 years. And that's from me talking to our providers. I talked to one provider who said, you know, when you guys give us funding to do things, we've always been able to hire people until this last year. So this is something that we are looking at. It was brought up in the Planning and Policy Council. It's my understanding that the Planning and Policy Council is going to be presenting a paper to us, the department, to look at. I also know that TAMHO has put together a really great paper that I've read on workforce shortage. But what we've done to try to respond to that, I have met individually with the heads of the Psychiatric Association for the state, for the nation, psychology, social workers, any group we can, to talk about how can we incent individuals to come into this field. I am doing my best to see what will work. We really are focused on evidence-based in our state, but this is something that we're going to have to work on together. Because it's going to take all of us trying to figure out how do we attract good talent that want to serve individuals in our state. So I hope that helps.
Great, thank you, thank you. We also had a question from Cynthia. What is being done to ensure that telepsychiatry services continue?
Absolutely. Yeah, Cynthia, thank you so much for asking that. I hope you're doing well. What we're doing is we've advocated and the governor's office has asked for all departments and commissioners' input about the executive orders that were issued. So what we've done is we have sent in our proposal. We would really like to see it continue. I know that many of my colleagues would as well, but this is another great area for your voice to be heard. Do not hesitate to let your legislators know. You do know that there's an executive order and also legislation that's been passed that speaks to this area. I guess what I would ask, Matt Yancey, are you on the call on the Zoom? Mr. Yancey?
Oh, hey, Roger, he might be muted. So unless he's registered under Matt Yancey, we might not know that he's on the call.
Yeah, I'm looking to see. I don't see that he's on here. I apologize. There is legislation. I see that Bill's on here. Bill, can you speak to the actual telepsychiatry, telehealth legislation that now is actually in effect and what it allows people to do? I think the one thing that's not that's only executive order is the telephonic, and that's one of those that we're advocating for. But can you speak to that? I apologize, I don't have that information in front of me.
Yes, I'll be glad to, Commissioner. The bill that was passed last fall expanded the use of telehealth across the state, and it also expanded the use of telepsychiatry. But it has to be used in a form like we're using with Zoom. It cannot be just an audible phone call. There is some legislation being proposed this year that will allow psychiatry services to be just audio, primarily used for follow-up. So there is so the use of telepsychiatry has to be involved face-to-face like we're having now, and in real time and with audio. It just cannot be, it cannot be phone call, it cannot be email, or it cannot be fax. So that's where we do have that accessibility now. It's been expanded through the executive order of the governor, Lee's, and also passed by the legislation by the General Assembly.
Does it go or don't go?
Hey, Bill,
Yes,
thank you so much for that. So if I were to break it down, the law allows us to do what we're doing right now, this Zoom, where it's face-to-face through a Zoom or some other kind of platform, right?
correct.
To do
Correct.
telepsychiatry and care coordination, all of that.
Yes,
The only thing that's not included in the legislation is the telephonic,
correct.
right? And that is right now being covered through the governor's executive order, right?
Correct.
So if people want to advocate, it really would be advocating for telephonic because the other stuff's covered, right?
Correct. Yes.
Thank you. Thank you so much, Bill. Cynthia, does that answer your question?
The one question we're still worried about is right now, prior to COVID, patients had to be in an office. They couldn't be at home. And so we're a little bit concerned that once COVID is over, it might be that patients are required to go back to an office in order to receive telepsychiatry.
Yeah, Bill, my understanding is that the legislation does allow patients to be served in their home. Is that correct?
That is correct, based on the law that was passed last August, and again, there's a bill being filed this year that would allow just telephonic telepsychiatry to be used primarily for follow-up between a patient and their psychiatrist. That wouldn't require coming into an office or having such an elaborate setup like a Zoom meeting like we're having now. So that bill is in the legislature this year. So we'll be looking at that and talking with the sponsors too.
Thank you, Bill.
We did have a question. I think Jeff posed it. You had mentioned the Policy and Planning Council. Can you
Yes,
talk
ma'am.
a little bit about how the regional councils are set up? Because we would like to try to see some more consumers and family members on the councils. And
Absolutely. Absolutely, we would too. The planning and policy councils, actually, we are supposed to have a certain number on the statewide council, right? That gets appointed by the governor, that's an advisory group to our department. There's a number of consumers and family members that we're supposed to have. We are meeting that number, I'm happy to say. But the regional councils, which are not appointed by the governor, they're actually set up in each region. We have 7 regions, and anyone can attend those. So all you got to do is look on our website and look up the date. And if your region, you can attend that meeting. We would love for you to attend that meeting, because what happens, Alisa, is that information every quarter, we have a report out by each region that I attend that statewide meeting to hear that. I very much want to know what is happening in the regions and what we're being told we need from the regions. I'm a big grassroots believer that it comes up, not down, but we need information coming up. So yeah, just look on our website, look at when the meetings are, and you can attend. And you'll also see who the chair is for your region. You might want to call them and say, hey, I'm with NAMI and I really want to participate. I'm going to be at your meeting. So that would be nice to do that.
Right. I think we've got Kathy Milam of NAMI Chattanooga that's involved with one of our regional councils. So thank you for that. There is a question. especially with this being Black History Month. Communities of color, a lack of awareness of available mental health services. And we are going to be discussing this in our March 3rd session. How can we push the information out to them?
Yeah, I'm looking at that. Thank you, Marina Kay, people of color. Absolutely. One of the things that we're doing is called the Faith-Based Initiative. Marina Kay, I know you know very well about that, where we are reaching out to all communities of faith. What we know about communities of color, what we've been told, is that oftentimes people are not, let me see how to say this, there's a fear around reaching out for mental health help. Now that fear exists in any area, whether you're not of color or of color. But what we're doing is trying to reach out to the faith-based communities where individuals go, so that pastors and leadership of that church would help refer individuals to care. I know that you're aware of Pastors Diane and Bishop Young in Memphis, which they are pastoring a large congregation that is concentrated with people of color. And we're doing what we can, broadcast to that demographic. But Marina Kay, if you've got good ideas, text me and let me know what you think. I'd love to hear them, okay?
And how are we doing on time on your end, Commissioner? We okay?
I'm fine. Oh yeah, I'm absolutely fine.
Yes, and I'm willing to give up part of my presentation because we're lucky to have you here. We appreciate
Oh, I'm happy to be here. I appreciate everybody that's putting on information up here where y'all can know where to go. Jeff, thanks for sending out our planning council information so people can see that. Marion, I did not realize you'd had 3 strokes. I am really, really sorry. Very sorry. Some of our meetings, Marion, are being done by Zoom. So I know that you can't go in person, but you might want to look and see what we're doing by Zoom. There's a question from NAMI about, is there any movement for more public psychiatric beds in Tennessee? And I'll speak to that. And then I'm really glad to know that Pastor Young's a board member of NAMI Tennessee. That's great. So to the question about psychiatric beds, one of the things that I spoke about earlier is data and how we make decisions based on data. So although there's a belief out there that we don't have enough beds, I can tell you that our census right now is right around 85%. What we don't have, it's not the bed. So we've got beds, and until that census goes like to 98 or 95, I can't advocate to put taxpayers' money to expand something that we don't need right now. And I know for those of you that have had a hard time getting someone in, what you're being told is it's the bed that's lacking. That's typically not what is lacking. What is lacking is the resource to, and Cynthia, Dr. Rector knows this well, is the trying to get people assessed to get them into the bed. That's our issue. It's that throughput. So from the time a person is in the community, and let's just assume that a person's at the emergency department, there are things that have to be answered about that person's medical condition to make sure that our state hospital is the most appropriate place for them to be, as well as the ability to have a staff person in our hospital that can actually do that assessment to move them through. But at this moment, we don't have a need to increase public psychiatric beds per our census, what we're looking at. The real issue is that throughput, and we're doing all kinds of things to increase that throughput. We're doing telepsychiatry between emergency departments. We've very much expanded that so that we can make that an easier process. I hope that answered your question.
Is that being affected by the IMD exclusion issue?
No,
Okay.
no, not at all. No, thank you. Thanks, Jeff, for asking that. It says, I see that Kay Castle said, true, there are no direct admits. A person must be assessed again at the state hospital. Now, I want to say something about this, y'all, that's really important about our state. Title 33 created an unbelievably fair process for people that we take their rights away when we commit them. Now, remember, you can get voluntarily placed in hospitals that do not do involuntary commitments. So, for example, if a person is exhibiting psychiatric symptoms and voluntarily want to go in to, maybe I'm in Nashville, so Meharry or Vanderbilt, that person can be admitted voluntarily. But in our state hospitals, those are involuntary commitments. And to make it as simple as possible, you have to have 2 certificates to say that that's true. That is not to make people wait. That is to make sure that we're doing everything we can to serve that person without having to take their rights away. So there's a cert that's done in the community by an MPA, mandatory pre-screening agent, who is trained. That matters because in other states, a police or sheriff can sign and put you in the hospital. That, I'm glad in our state we don't have that. I'm glad that we have a mental health professional that's assessing to say, do you need this service? Do you need inpatient, involuntary? And then the admitting facility, in this case, one of our hospitals, our doctor, like Dr. Rector, when she worked with us, they do the second assessment to confirm that that person truly is a danger to themselves or others and needs involuntary hospitalization. So that's exactly how our system works. And it works to give people fairness and make sure that we're doing all we can, because we've got so many other services like crisis stabilization units that don't take away your rights, right? I mean, there's so much. We got respite. We got same day access. So in our mental health providers. So thanks for asking that question. I hope that answers that.
We have about 3 or 4 minutes left
Uh-huh.
on our schedule. So we have a few more questions if your schedule can accommodate.
Yes, absolutely. Yeah. So Kelly McCrae, your question, danger to yourself or others, is there a definition? Yeah, it's in Title 33. And I'm using that language to break it down. There's more language. To me, that's like the bottom line, but it has in our title and in our cert, there's different things that you have to meet that criteria. So thank you so much for asking about that. It's very detailed. Thank you, Marina Kay, for what you're saying. We do have a wonderful resource, and the goal is to help. You're absolutely right about that. That's why I encourage everybody, please reach out to us. Please don't complain. If you've got a situation, we can help you. I promise you, we will do all we can to get it resolved. Let's see. I appreciate Kay Castellal. Yes, the more assessments, the better. Absolutely, to protect individuals' rights. I'm sure many of you have heard that in the beginning of psychiatric hospitalization, back in the 1800s, people could get hospitalized just because their husband said they need it, and then they'd stay there forever. I'm seeing Tony Stevenson shake her head. I mean, I'm so proud of our system. I am so proud of our system, being a social worker myself and working in the system. We protect people. And we make sure that they are getting what they need through a process that's fair. Any other questions, Alisa?
I think we're okay. Just given the time element. We could probably sit on the call here for an hour and ask questions, but we appreciate your knowledge, expertise, experience, and most of all, your passion for people with mental illness and their families. And so we want to thank you so much for being here today.
Thank you. I feel very called to this and have been in this field for over 30 years. And again, want to do all I can to help individuals and have an incredible team. As I said, our team is amazing, and they're as dedicated and passionate and caring as any other team you'll find in any other state. And Alisa, as you work with us, I'm sure you can attest to that.
Definitely. It's an impressive team for sure.
Thank you.
So thank you. Hope you stay warm, and thank you so much for being here today.
Absolutely.
And next we have on board Bill Dobbins. And Bill Dobbins is the lobbyist for NAMI Tennessee. He's the owner of Dobbins Government Relations. And he is known at the Capitol as being probably the go-to person on mental health legislation and mental health policy. So we're really lucky to have him as our lobbyist. He's been with us for 12 years. When I asked him for his bio, he wanted me to include as a personal note that he's been married 44 years to a woman he met on a blind date. So that's a nice factoid about Bill Dobbins. So Bill is going to talk with us about the role of advocates. So thank you, Bill.
Well, thank you very much. And again, I cannot compliment Commissioner Williams more and her staff. I've told her this, I've told this to legislators, that I think that the Department of Mental Health, I believe, has the best leadership team of all the departments in the state. You see Commissioner Williams' passion, her smarts. She knows the system. She knows what needs to be done. She knows where the fault lines are. She knows where the strengths are. And we're very fortunate in this state to have Commissioner Williams and her team on board, and very fortunate to have Governor Lee to continue her leadership. And we have in Tennessee, for the first time in my memory, a governor who really gets it about mental health and services, and through his leadership and his candor, we are talking in the public policy field more about mental health and issues and funding than I can remember. And this is we all need to take advantage of this. That's what advocacy is really key. I tell many folks who want to come and lobby at the legislature, who's the key person I need to talk to? Who's the person in leadership that I need to talk to? And my answer is always the same. The most important person you need to talk to is your own state representative. You don't need to speak to this, talk to the Speaker of the House or Lieutenant Governor or the political leadership. You need to talk to your own state representative and state senator. Those are the most important people you as an individual need to talk to on any issue, particularly about mental health bills. And many people will not be aware that they have state legislators and they have congressional legislators, and often they get the two confused. And a very easy way to find out is to go to the state's website. And I'll type this in. You can go to www.capitol.tn.gov. And this will get you to the legislative website of the Tennessee General Assembly. And on the right-hand side, there is at the very top of the website, it has a drop-down box called Find My Legislator. You click on that, and a drop-down box shows a map of Tennessee, and it has on the right-hand side street address and town or a city. You just type in your address and your town. You click on that, and your state representative and your state senator will pop up. as will the hyperlinks to send them emails to their legislative website on the General Assembly. It gives them the phone number, email address, room address at the state capitol, staff support, a link to all the bills that they have sponsored, a link to the committees that they're on. The legislative website for the General Assembly has been recognized nationally for its user friendliness and its accessibility, and has won many awards. So I really encourage all of our advocates to go to that website. It's a wealth of information. It's easy to navigate. You can also look at what bills have been filed. You can look at what bills are coming up in committees for the next week. What budget hearings that are coming up, that Commissioner Williams will be participating in those over the next several weeks. He'll be speaking to the finance committees in House and Senate, the health committees in the House and Senate. So you'll have the opportunity to hear budget presentations also. So it's a wonderful website. It's easy to navigate, and it's not hard to be an advocate. As was mentioned earlier, just tell your story. These legislators, that's what Commissioner Williams mentioned, they're just average people. They're just regular people like you and me. They might have a little bit larger ego because they asked for you to cast a vote for them. But other than that, they're regular, good folks, and they all want to do the right thing for their constituents and for the state of Tennessee. They have different philosophies on how to go about doing it, but it doesn't mean that it's necessarily bad. They just have different approaches or opinions on what they think is the best policies to enact to get things done that benefit all Tennesseans. So it's okay to disagree, but it's just a difference in philosophy, not being a disagreeable person. I have met over the years some wonderful legislators, Senate and House, who truly care about Tennessee and the people here. And they really want to do the right thing. And that's where the role of advocates come in, is that we can help steer that conversation on what's the right thing to do, particularly in mental health and in mental health policies. So the idea is that, again, I'll echo what Commissioner Williams says, don't necessarily bring anecdotal stories. Let's get information and facts. By getting our information, doing our homework, and getting facts, we can present that and put the stories, the personal stories we have of ourselves, our families, our friends, and the interactions we've had with mental illness or substance abuse programs, and back those stories up with facts that will help guide and inform our legislators on which is the best path, which is the best policy for them to adopt that will truly benefit the people of Tennessee. So again, it's I encouraged all of us to reach out and send just a simple email or letter. Handwritten letters are the gold standards of reaching out to legislators. I can't tell you the number of times I have walked in on legislators in their committees or in their offices, and they're reading handwritten letters from their constituents. This means so much to them because they know that a handwritten letter means that person has taken the time to write this letter to him or her. You know, most people would send an email or type a letter, but a handwritten letter is literally the gold standard. And it means a lot to these legislators, and they do read them. Some people will not believe that their staff member will take a message and send it and give it to the legislator. And that is absolutely not true. If you cannot speak to your legislator, then leave a message. I assure you, every legislator reads messages left by their constituent. If you leave a message or you talk to the staff person for that legislator, he or she will share that message that you've left with that elected official. So do not feel put off or ineffective if you didn't talk directly with your legislator. Always leave a note, always leave a message, phone number. It's important as an advocate, particularly in mental health and substance abuse, that you want to become that legislator's expert in this field. Not every legislator is an expert in all the fields that are debated with the legislation. Currently, there are 1,600 bills filed with the Tennessee General Assembly. And no one legislator is an expert in all the topics that are covered with these 1,600 bills. So they're looking for expertise, and Commissioner Williams and her staff provide outstanding expertise on mental health programs and policies. But as an advocate, you provide that grassroots back home expertise, and you want to become a mental health expert for your legislator. If he or she is not that familiar with it, you, because of your experiences with personally or with family or with friends, you can become that expertise. And by staying in contact with your legislator, whenever you call your legislator, he sees, oh, it's Bill Dobbins is calling me. He's going to talk about mental health. That's what you want. You want to be able to be that spokesperson for your legislator to make sure that he or she is up to speed on policies, on legislation, so that they can, vote correctly for amendments and bills and for funding programs like Commissioner Williams' department, and also speak intelligently and responsibly about public policy and legislation. So again, organizations like NAMI, we're not deep-pocketed. We are a grassroots organization, and what we lack in funding for writing big checks for campaigns, we make up for outreach effort and coordination, and making sure that our votes count when elections come up every so often. Another way to reach out as grassroots advocates, write a letter to the editor, to your local newspaper, or do an article, do an interview. These are great ways to reach out and provide input and have an impact on policy in your community. And again, this doesn't cost a lot of money. This is very inexpensive ways that a grassroots advocacy can make a difference. And by participating in NAMI's public policy meetings, with our keeping track of legislation, when bills are coming up for debate in committees, it's important to reach out as grassroots advocates, reach out and contact your legislator who's on those committees and express to them which way you think they ought to be looking on these bills that they are debating on mental health. If it's a good bill, please encourage them to support it. If we think it's not a good bill, ask them to vote against it or to amend it in a way to make a bad bill better. There's always ways that we can take a good, a lot of legislators will follow a bill with good intentions, but it's it's our task to look at the potential impact of these bills and what are the unintended consequences. And that's our job to analyze that. And when we see some unintended consequences, we try to work with the sponsors to amend their legislation to make that bad bill better. So
Hey,
we
Bill.
try to keep all of you informed on those decisions. Yes, Alisa.
So you bring up a really good point, talking about analyzing the legislation, trying to make bad bills better with amendments. So I just want everybody to understand, because we do have some new people here, that that is the responsibility that falls on Bill and then me as the policy director. And then it's my role to educate you all, the grassroots, the people on the ground, and educate you as to what's going on at the Capitol, so then we can use our voice to try to influence change. And I'll be giving some examples of that here in a few minutes. So
Hey,
I just,
Alisa.
yeah, yes.
Alisa, can I add a couple things? Number one, we're so fortunate that Bill Dobbins is in his position, and that he's chosen to really help and support mental health issues. Bill, it's always been a pleasure to work with you. And one of the things that I believe makes our state so good are people like you that seek collaboration and partnership and working together versus tearing down. You've always been a person that has wanted to work together, and you represent what we do very well in the legislature, and I've heard that from many legislators. I also want to congratulate you on being with your wife, who's just the most wonderful person ever, for the more than 40 years that you've been with her. And your suggestion that you gave, Bill, about talking to your editor, a letter to the editor, or calling and saying, hey, I'd like to tell you about this story. It's always so good when people can see in their hometowns things that are working. And again, I'd like to ask people, if it's not working, before you go to your editor, please come to our department and
Yes.
let us please try to help make it work.
Yeah.
Because that's something that we will do. But thank you. Your words are awesome, Bill. I wanted to stay and listen to you. And so anyway, that's all I wanted to say. Thank you, Alisa.
Well, thank you very much, Commissioner.
And Bill, thank you for your comments. And we will be getting into more training on how to tell your story to legislators next Tuesday, February 23rd, in the second of our series. And if you can't join us on that day, then you can watch the recorded video that we'll have available for you. So we do need to get into our policy priorities, and we're just going to keep it very high level. We're not going to go into the weeds. And so, Bill, if I know you might have, I think you had another appointment later this morning, but if you're able to help me quarterback this, I would appreciate your help.
Sure.
So,
Sure.
and anything, oh, there was a question, do we use the same link to the next session? We're going to have to work through that because there were some problems this morning. So we will send out the link in advance of the next session. And if you are registered for this session, you are registered for all 5 sessions. So you don't need to re-register. So, okay, I'm just told there will be a new link for the next session. Okay, so Roger, if we could queue up the PowerPoint, and I'm going to put in the chat box our policy priorities. Let's see. Okay. So these are our policy priorities, and basically, we'll go to the next screen. Thank you, Commissioner Williams. So as we start, I just want you to see can you go back? All of the materials any talking points, any background information are going to be available at that website, the webpage below. And we'll be adding policy papers as we go. So if you'd like to learn more about some of the issues that I'm talking about, especially the 4 that we're going to highlight today, you can go to our webpage and learn more. So next slide. So we'll be talking about our policy platform, 4 areas. And what I asked you to do, what I would invite you to do, is to see if any of them resonate you. Some of them are pretty technical, but others might really hit you at home because you've had an experience in this area. Again, we're going to teach you how to talk with legislators next week, and there's how you access our background materials. Next slide. A policy platform is a list of policies that we support. It's that simple. And we come up with this list each year prior to the legislative session. And it creates a roadmap of where we want to go in terms of policies. So one of NAMI Tennessee's functions as the statewide organization of the NAMI Alliance is to set the legislative agenda and the policy direction each year. So that's what this document does. It reflects our core values, what we stand for, and where we'd like to go. Some of the things that we consider is whether or not a policy is viable, whether its passage, there's potential for influence and passage. There's no sense burning our energy on issues that aren't going to pass. Now, that's not to say that we shouldn't advocate for them, because it's our job to voice areas of concern. But there is some strategy involved with this, and we do this in communication with our NAMI affiliates. For those of you who are new to NAMI, we have a national organization in Arlington, Virginia. Then we're based here in Nashville, and then we've got 20 local affiliates around the state with leadership. So we'll talk a little bit more about how to get involved with that. Next slide. Okay, so our priority is, number 1 is helping people hurt by the pandemic. One of the things that we've been involved with for a few years is policy discussions and legislation making Tenncare available to more than 250,000 Tennesseans. Right now, Tenncare is available to individuals who make between $12,880 a year. The so-called Tenncare expansion, Medicaid expansion, would increase that limit to $17,774. Tennessee is one of the, I think, 14 or so states that has not extended Medicare to this broader population, and that's something we're trying to change. So in other policy areas, we want to see more services to our young people. And then finally, and as was mentioned earlier in a question with Commissioner Williams, we want to make sure that there's more public awareness programs for mental health. Next slide. So another policy theme is providing help so people can build better lives, because at NAMI, we believe that is the case when they get the proper treatment and services. So we want to see more walk-in centers regionally. People in rural counties should not have to drive 2 hours to get to a regional walk-in center. We want to see more money for individual placement services, those services that make it possible for individuals with severe mental illness, the bipolar disorder, schizophrenia, and so forth, see them have opportunities for supportive employment. And finally, increase transitional housing for individuals in recovery from the disease. Next slide. Our third area of focus is diverting individuals from criminal justice. Many of you know that NAMI has been intimately involved with the Crisis Intervention Team program for many, many years on a national level and here at a state level. The CIT program was born in Memphis. So we do have a stake in this. We are very involved with training law enforcement, both through a U.S. Department of Justice grant and through funding from the state that we're going to seek, which I'll talk more about in a minute. And we want to see more pre-arrest diversion programs that can help people get help, not handcuffs. Next slide. And then finally, this part gets a little technical, but we want to break through the bureaucratic red tape. We have also been involved with other groups about what's called insurance parity. And this is making sure that health plans provide mental health services, behavioral health services, substance abuse services in the same way that they would for physical health. And so we've already got a bill filed, thanks to Bill Dobbins for helping get this going and getting our sponsors. And you see the bill number there. And we also would like to see health plans have more numbers of mental health professionals in their provider network. And we anticipate some legislation on that as well. Next slide. So here are some groups that we've worked with. Our role, again, at NAMI Tennessee is to coordinate and collaborate with other partners. And here's some statewide coalitions that we're working with. These are some of the areas. Next slide. So we'll take a deeper look and spotlight Tenncare Coverage. I mentioned how pending legislation, I don't believe it's been filed yet. Bill, has that bill been filed?
Which one is that?
The Tenncare expansion. There's been some discussions among some Republican legislators to have another bill this year to make Tenncare more available.
There is a bill filed that will allow that, but I don't think the sponsors are going to move on it this year. So it's just to be, and again, this is a little technical. A General Assembly in Tennessee is a 2-year term. So a bill filed this year that doesn't go anywhere is still viable next year. And so what the sponsors have done, they have filed a bill that will be amended to address some type of expansion for Tenncare. But the last I heard, the sponsors are going to wait and wait till next year to move it. I guess I want to see what happens with this new block grant and see if this bill might be amended to complement or expand that. So, but it has been filed, yes.
Okay, that's what I thought. And regarding the block grant, you all might have seen in the news that the Trump administration approved Tennessee's request to revamp the Tenncare program. And without going into a lot of technical detail, it would put a cap on the total amount of money that Tennessee would have for Tenncare. And it promises savings that would be reinvested into different areas of healthcare, maybe different populations. We have raised a number of questions along with most other individuals and organizations across the state about how this is going to work. We're concerned about potential caps on medications for mental health, behavioral health. We know that NAMI on the national level has been working and speaking with the Biden administration's transition team, because we would like to see this rolled back and then proceed with expanding Tenncare, because Tenncare is a successful program. It works. It's proven. So this is just an issue that we're going to be working on over the next couple years. Pre-pandemic, this coverage gap between the roughly 12,000 and 17,000 or so would have, there's about 300,000 people, but this is before the pandemic, before people lost their jobs. So potentially 20% of individuals, 1 in 5 each year, are affected by a mental illness. What we're seeing now is reports from the CDC and other areas that it's 1 in 2 now because of everything going on in our country and in our world. So conceivably 150,000 people in the state of Tennessee could have a mental health challenge. So that just shows the importance. And these 150,000 people are people that don't have health insurance. So this is why this is a priority for NAMI Tennessee. Next slide. We talked about the Tenncare grant. Next slide. Crisis intervention team. So CIT creates a community approach to responding to people in crisis. What this program does is it pulls together stakeholders, families, the court system, law enforcement, to discuss ways that law enforcement, police officers, sheriff's deputies can respond to a person in a mental health crisis in a way that doesn't land them in jail. We want to get them help and not handcuffs. And what we're asking for is $200,000 in the budget. And we're going to be working with some sponsors on that, some legislators. So we're going to be needing your help in reaching out to your legislators this year and asking for their support for this funding. This issue will get, it'll pick up later in session when we start talking about the budget. They basically just came back and started getting down to business last Monday, but of course, right now everything is shut down because of the weather, so the Capitol's closed. So just know that we're going to be asking for you letter writing, phone calls, emails, and so forth around our budget request sometime in the next couple months. Next slide. Insurance parity, we talked about that. So that bill has been filed. And right now it's a so-called shell bill. It's the details aren't there yet. And Jeff and Bill and I have been part of a bigger team of other organizations coming up with the language with this. And we thank Bill for, I think you helped draft that along with Tatis. Yeah. So we'll be, again, reaching out to you when this bill starts moving, hopefully when it starts moving, to talk about why it's important that health plans cover mental health services like they do physical health services. So an example of a situation where they might not is, say, for example, you break your leg, you start to heal, and you need physical therapy services, okay? And you get approved for therapy services for your leg. But you have to go through a prior authorization, and then there's a limit on the therapy services you need for anxiety and depression. Okay, that should not be any different. Your therapy for depression and anxiety should not have to go through extra hoops. You should not have to do that. And so that's one of the things that we have been working on for a few years now. And we also are part of a group with the Kennedy Forum. If you want to learn more about that, we do have resources on our website, and I would encourage you to Google the Kennedy Forum. So next slide. So we actually have a bill in motion right now that we will be, within the next 24 hours, asking you to weigh in on. This is Senate Bill 230 and House Bill 16, and it's very troubling. So it's called the Teachers Discipline Act, and it's very heavily favored on teachers, giving them the ability to remove a student from the classroom if there's disciplinary problems. Well, anybody that's watching knows if you have a child or you yourself have had a mental health challenge that you don't need discipline, you need help. And what we're concerned is that this bill gives teachers unilateral authority to have a student relocated to another classroom, to an alternative school, and even call in law enforcement. And at no point in this bill does it say that the child should get a mental health assessment. And that, I don't know about you all, but that's an area that, I just have a lot of passion about this, and this is one we can make a change. So what you'll find tomorrow is you will get an email asking you to write your legislators about this. This bill passed the full House last year unopposed. And the strategy is we're going to focus on the Senate, but we are asking you to contact your local legislator, your House member, and your Senate member to tell them how troubling this is. I will have talking points, which means you don't have to dig for facts and figures. I can do that, and I'll give you a sample letter. So again, we just wanted to bring this to your attention. So next slide. Again, oh, and we will have a social media storm next week on this. So I'll be teaching you how to post on Facebook, how to tweet, and so forth. So I see a message from Nicole, a huge red flag for you. So Nicole Price, you are the perfect person to tell your story to legislators about this bill. And again, check your email tomorrow. So I'm going to stop there and see if there's any questions. Let's see. So reimbursement toward providers addressed in 360 Senate Bill 151. No, okay. Let's see what else. Huge red flag. So Nicole says, yeah, so to know if one of your children were to have a breakdown and a teacher could have them removed like that is just disheartening. Yes, we agree totally. And so, like I said, we are working with other groups, Tennessee Disability Rights, Tennessee Voices, because we share the same concerns. And it's very, very troubling to say the least. Any other questions? So I didn't go into a lot of detail in these bills because, quite frankly, you all don't need to be the expert. That's our job. You all just need to be in the position to tell your story about how a bill might affect you and to tell that story to legislators. Again, our storytelling training will be next week. I encourage you to attend. And I think there was a poll. Yes, here we go. In the past, I have communicated with a legislator. And so over half of you indicate that you have for a few times, but 37% say that you have never communicated with a legislator. Well, we would like to change that. So we encourage you to stick with us through this series. And I'm going to give you an email address. If you want to get on my mailing list and get a little bit more involved with policy, if you're like me and I'm a policy nerd, it's just, how I am. But if you want to get a little bit more in learning the details about bills and strategy, you can email me at advocacy@namitn.org. We'll put you on the policy advisory committee. It has not met yet. We'll probably start here shortly, and love to have your input. Bill, is there anything that you want to say briefly about our priorities, or just moving forward? What the anything regarding the legislative agenda that we have?
Well, just in general, for those of you who have not ever reached out to your legislator, send us an email. Do that after the call is over, because they're not in Nashville now because of the snow. Just send an email and introduce yourself. Hello, I'm Bill Dobbins. I'm your constituent. I want to let you know that I'm very interested about issues that impact mental health here in Tennessee. I would like to have a chance to talk to you at some time at your convenience. And that's all. You don't need to go into any long story, just a icebreaker, just an introduction. That's a wonderful way to start that conversation, to start that relationship. So start there. Just a simple letter or email of introduction. For those of you who have infrequently talked to your legislator, same thing. Reach out and say, dear sir or madam, and say, hope you're warm and safe during this cold weather. I want to again, remind you, I'm very interested in mental health issues and want to make sure that I can be a resource to you as you debate these bills. So I tell people, politics is a contact sport. You have to reach out and contact people. You have to contact them by either phone call, email, letters, or even when you have a chance to meet them in person. But it's a contact sport. You've got to be in contact. So take that first step and introduce yourself. You'll find a lot of these legislators will be very grateful that you've reached out, and they will need your expertise because they're not mental health experts. You are.
And this is a great segue to my second presentation. It's going to be really brief. Roger, if you could tee that up, that would be great. A couple points I want to make is because we're in unusual circumstances with the pandemic, accessing your legislator in person is pretty difficult. They're really restricting visitors this year. Yeah. And so that puts legislators in the position of having to be the lobbyists themselves on certain bills. So we're not going to be able to go in and necessarily meet with different members of a committee, different legislators. There's going to be a lot more interaction between the legislators themselves, if that makes sense. So it's going to be more important for us to educate each legislator so he and she can speak to our issues to their colleagues on committees. Because right now, we're watching committees on Zoom or on the state government broadcast. And the second thing, Bill mentioned letter writing. It's going to be super important this year since we're not able to meet in person. So talking about reaching them with a letter or email is critical. And I can't underscore that enough. So here's how you plan a meeting. The meetings, we're going to encourage you to schedule your own meeting. I'm not doing that this year just because it's, we're just in a pandemic. So the first thing you do when you want to plan a meeting with your legislator is find your House or Senate member on the link that we've provided in the chat room. And it's also in the advocacy toolkit that you'll find on our Days on the Hill webpage. I encourage you to look at the advocacy toolkit. It has lots of tips for writing a letter to a legislator, outreach, and so forth. If you're a NAMI Tennessee affiliate, we would encourage you to pull your group together to decide who's going to speak on the call. These meetings are going to take place by Zoom more often than not, or by phone call. So you want to get your group together, call the legislator's office or email. A lot of them are asking for email appointments now, and then start preparing. Prepare in terms of like looking at our policy papers, doing your research. Next slide. So as I mentioned, the in-person meetings are being discouraged because of COVID. One of the things that we're having to figure out on a case-by-case basis is whether the legislator himself or herself will have Zoom capability. More often than not, we're having to use our own Zoom account to then host the legislator for the meeting. Bill, have you had any run-ins with that or experience with that?
No, I haven't had any response or impact with that yet. Okay. So I think we're just getting started now. Right.
So again, it's important to educate them so they could turn around and educate their fellow legislators because we can't get to them at the Capitol. Next slide. So when you reach out to the aide, that's the person that will answer the call. The aide is responsible for the scheduling. Some might have a scheduler. You'll be asked, what do you want to meet about? Mental health legislation, NAMI Tennessee's legislative agenda. Now, if you are watching from a local affiliate, if you have additional issues that you want to discuss at the local level that's not on our list, please do so, okay? this list is not exhaustive. So please feel free to add issues maybe that your Cedar County commissions need to address. Let your legislator know, those branches of government are different, but your legislator needs to know what's going on at the local level. So before your meeting, I always try to Google my legislator, find out what she or he is involved with. There's some opportunities to connect. You'll find sometimes you went to the same high school, or maybe your parents knew each other, back in the day, or maybe you go to the same church. Like I said before the meeting, just in your group, determine who's going to be the spokesperson, and then try to do an outline of what you want to say. These meetings are maybe 10 to 15 minutes. You might get a legislator that likes to do all the talking. That's fine. Let him or her do that. You can always come back around and send them policy papers and email about the subject and your thoughts on it. Next slide. When you're in the meeting or the call, you want to introduce yourself. I'm Alisa LaPolt. I live in Nashville. I grew up in Greenville. Here's my story real quickly about why I'm interested in mental illness and mental health. You want to refer to them as representative or senator. Explain why you're there. I'm here because I want to talk about the bill that would allow teachers to remove students from the classroom. Deliver your message. That means here's where the problems are. Here's why I think this is a problem, and here's some potential solutions, which, by the way, I'll be providing you the next couple of days. Also, when you meet with the legislator, remind them that you are a resource. Bill spoke to that. Please call on me, Representative, if you have any questions about how mental health policies affect families, affect individuals. And then finally, you want to thank them. Next slide. So when you are meeting with them, you want to share your personal story, but make it brief. Again, these meetings are 10 to 15 minutes. It's okay to meet with an aide if the legislator is not available. A lot of times the aides are not only the traffic cops, but the brains behind the operation. They're the ones that keep the legislator on track, brief the legislator on issues of importance. Again, follow up with any news articles, materials, talking points that you think bolster your argument and will be convincing. Next slide. All right, these are important. Don't feel like you have to get a vote on a particular bill right then and there during the conversation. That's not your job. Bill and I, that's more of our job, to get the vote counts, try to pin down people and so forth. Don't argue. Please don't ever argue with a legislator. Some of them have certain views and you're not going to move them. Your job is to educate, okay? And then we can just move on to another legislator who might be more movable. Don't dominate the conversation, let others talk. Never threaten a legislator, especially I'm going to vote against you. I'm going to get all my friends to vote against you. All right, that's just not going to work. And please don't get into a conversation about federal politics, presidential politics. It's just too polarizing. We've got a lot of work to do in our state around mental health, and we'll just focus on that. Next slide. Campaign contributions, like I said, don't threaten to withhold campaign contributions. Also, don't promise a legislator to give them money if they vote a certain way. That's highly unethical and illegal. And then when you have a meeting with a legislator and you're going to report back to your NAMI affiliate, be careful what you put in writing in an email, because I have seen situations where those emails wind up back in the hands of the legislator, and it's not pretty. If you put something real candid and negative about the legislator, just know that you don't know where your words will end up. Also know that anything you put in writing to a legislator can be included in public records, it's a public document, and our laws here in Tennessee are very broad. So public records requests can be made of legislators, and you wouldn't want your email with anything negative to come up in a newspaper article. So just be aware of that. Next slide. Contact me if you can't answer a question. It is perfectly fine, and it's, in fact, it's to be expected. Okay, if you have a policy question you can answer, just contact me. Sometimes they'll ask for follow-up information. And again, stick to the agenda unless you're with a NAMI, a local affiliate, and you have additional things you want to add. But if you are meeting as an individual and you have other issues you want to discuss outside of the NAMI Tennessee agenda, we ask that you just set up a separate meeting. Bill mentioned this, not all of the legislators sit on mental health committees or health committees that deal with mental health. So it's okay if they're not familiar with our bills. Just know that, don't be offended. Commissioner Williams spoke to this. Lawmakers will be, in most cases, surprisingly kind. Next slide. You're the expert on your story. That's your specialty, that's your expertise. And again, all these tips are in the advocacy toolkit. So what we want to do is tee everything up for next week. We encourage you to start, if you don't already, follow your legislators on social media, because next week we'll be having a social media storm and we're going to be posting about that school discipline bill, the teacher discipline bill. So just go on Facebook, and once you have found out the name of your legislator, do a search on these social media sites and become a follower. They read their posts, and they, everybody likes having a lot of followers on social media. Next slide. But if you're going to start following them, do not start engaging in arguments. And we all have seen it. The tone of social media has become so incredibly negative and awful. Please, please, please don't buy into that, because you are representing this organization, and we want to leave a good impression. We can influence people. I like this, you can attract more flies with honey than vinegar. That's my philosophy in lobbying and advocacy. Next slide. There was a question that just came up about when you do find your legislator, do you put in your business or your home address? I would say both. Home address in that, because they could be two different legislators. Home address, because that is the person who is your legislator. That's the person who you will vote for, like their district. That's the voting district that you're in. But if you have a business, type that in, because you could reach out to the legislator and say, hey, I own ABC grocery store down the street from you, and we've got some concerns. And I'd like to talk with you about this. So they would want to hear you're a business constituent. So yes, I would reach out to both. Let's see how we're doing on time. Okay. Well, this is great. So we were hoping to have a legislator here to walk through what a meeting would look like, but they've all gone home. They're not in school today. It's a snow day. So we don't have one. We are sharing our poll results. How do you feel? Right now, I feel prepared to contact my legislator to set up a conversation about mental health policies. Well, great. 40% agree. 14% strongly agree. So the 12% that say strongly disagree or disagree. This is a great opportunity if you want to learn what would you like, or where are your concerns, because I can answer them, and then we can talk more about that next week. Again, we didn't go into a lot of the policies today. Our talking points will be available on our website, and we will email you when they're available so you can go through them.
Alisa, if I may, people that are uncomfortable, they've never done this, let me volunteer Alisa to, you can role play with her and practice, because the first time is the first time, and after that it gets easier. And I wanted to point out one other thing, that Commissioner Williams, you heard what she said and the way she interacted, that our voice matters. The reason that she respects our voice is because people have taken the time to show up and talk to her at policy planning, or I call her, other people contact her over time. So at the beginning, if you only say, I'm part of NAMI and I care about mental health, let me tell you a little bit about why, that is fine, because when there's a specific issue later on, Alisa will give you talking points about a particular bill, and we hope that they might support our position. So you don't need to do that the first time. I'm Jeff Fladen, and I live in your district. I wanted to introduce myself. I care about mental illness. My father had bipolar disorder. I've worked in the field for many years. I've been treated for depression myself, and I'd like to be able to call you again if there's a bill or if there's something where I'd like to request your support. Would that be appropriate, Alisa, to do it like that?
Yeah, oh, sure. Again, you don't have to be the expert on the mental health policy. You are the expert in your story. All you need to do is send them like our policy paper, like our talking points. So I'll give you an example. I will have a document tomorrow on this school bill, and you don't need to be the expert on that. All you need to do is forward my policy paper to them. And then in your email, you would say, this is why this is a problem. I'm a parent. I would hate to see my child removed because he or she has anxiety and is acting out. So don't feel like you need to be the expert.
Yep. I'd like to share one other thing, is I would like all the legislators and the governor and the commissioner to know what NAMI is. So when you announce that you're part of NAMI, it's different than if I'm getting paid, which I used to work at a mental health center, and they're good people working hard. But if you're a hospital or you're a provider, they could think, well, you just, you want to stay in business, which is not a bad thing, actually. But when we come at it from NAMI's point of view, if I'm an advocate, I'm a caregiver, I've got a diagnosis myself, I'm not looking for money. I want them to know us and know that NAMI's there, that the voice of caregivers and the voice of people with a diagnosis are part of the conversation. So you hear in the disability world, nothing about us without us. So it's kind of that idea that it's not just professionals and professional lobbyists, although I do appreciate Bill Dobbins and his expertise, and he guides us, and we're lucky to have him.
I put a link in the chat room about NAMI membership, and there's various levels, individual, family. There's an open door policy, open door membership for $5. We would encourage you to join, but just know that to be an advocate through NAMI Tennessee, you don't have to be a member, but we would like to work with you and learn more about your story, and we appreciate your willingness to be an advocate with us. So Roger just put up a poll, grassroots advocacy in you. We're trying to measure what you've learned, and then how we can improve in the next session. So if you could respond to the poll, that would be great. I am able to stay on after 11. We're scheduled to end at 11 if anybody has questions. We do want to show a really brief video about our upcoming NAMI walk on May 22nd. It's just a really brief 30-second video. Roger, can you get that queued up? So go ahead.
been a year, and that's why we decided to do this on her anniversary of her death, to live like Sierra and together come and do this NAMI Walk Your Way. Mental health all means no one will get left behind.
Great, thank you. So again, that is May 22nd. We do put out materials in our weekly newsletters about the NAMI Walk. Jeff, is there anything you want to say about the NAMI Walk?
Well, the NAMI Walk does help raise money for the state and our programs and affiliates. Most importantly, it raises awareness of that mental health matters. And so we hope to increase visibility about the work of NAMI. And you can invite your legislators to the walks. They'll be virtual this year, but that doesn't mean they're all on computers. An affiliate might gather in their own community and have a little walk socially distanced with carrying signs going around the courthouse. So if you're friendly with your affiliate legislator, you can invite them to that, or you can invite them to one of your meetings as well. So they're your friends, and the more we interact with them, the better it will be for us and for the people we care about.
Great, thank you. I am typing my, if you have any questions, there's my advocacy email. Feel free to follow up there. We did have a question about the teacher discipline bill. It had to do with, will behavior health liaisons be able to intervene to remove the children? No, not in this bill. And that's what we're concerned about, is because we have all these behavioral health liaisons now, and they need to be integrated into this process. And this bill would further remove them from the process. So that's one of the issues that we're concerned about. So, and if you could, let's see, the link for the walk.
I'll do that.
Okay, thank you. Yeah, if you could complete the poll, we would appreciate that. We appreciate your time and look forward to working with you as advocates, invite you and encourage you to attend our next sessions. And thank you so much for being here. Again, I'll be available for any questions. You just put them in the chat.
Can I ask in person instead of by chat?
Okay, oh sure, yeah. Let's do it this way.
It's so much easier.
Sure.
I just wanted to know, can people who have not registered for this Days on the Hill access the recordings?
No. Well, yeah, I take that back. Yes, because we will have it available on our YouTube channel at some point. But when you register, you will get an email notification that they're available on our website, on our Days on the Hill page.
Mm-hmm.
So yes, you will be able to access it.
Because I was going to tell my affiliate that they could access this even though they didn't sign up for it, if that's correct.
Yes.
Okay.
If you go to that Days on the Hill
All right.
page, it'll be on there. Give us 24, 48 hours.
Right.
So,
Okay.
Yeah.
All right. Thank you.
You're welcome. Thanks for being here. And Marion, I see your question about NAMI Memphis. I'd love to have our West Tennessee Regional Coordinator reach out to you about that and talk a little bit more in detail with you, if that's okay. Any other questions?
I just had 2 quick comments, if I might. I have visited in West Virginia, and I urge anybody who goes to West Virginia to visit the old mental health facility. It's huge in West Virginia. It served a whole bunch of states, and it was built in the 1800s. It is now open for public tours. It's fascinating. And that's where I learned about how easy it was to get people into mental health centers, that a man could just drop his wife off and say she needs to be here. And that was all that was required. And she had to stay there until he decided to let her out, if ever. And that was a shocking thing to me. But that tour was fascinating to let us know how far we have really, really come.
Yes, and the commissioner spoke to that practice several years ago. So thanks, that's interesting.
Right.
We had a question from Rachel, and so happy to see our NAMI Chattanooga people here. You guys have a really good advocacy effort going on there. Any tips for crafting conversation around local issues? I think that could be a whole other session, certainly. But a lot of it has to do with the same recommendations for this. You reach out to your policymakers, your city commissioners, your county commissioners, letters to the editor, hold a Zoom call like this, a town hall. So those are just, like have a mini event like this at the local level. Pull in somebody from law enforcement, from the court system, your local treatment center. So. Do our police forces have mental health assessment and response teams? Jeff, can you answer that one? I think you're a good person since you've worked with law enforcement.
Well, no. A lot of police do have CIT in many communities, which is a community program as well as a training. And the community program piece is bringing together mental health and others, NAMI and other stakeholders, so that police learn about what's out there to help people. And the idea of trying to avoid arrest and move people toward treatment, it's county by county. And we have 95 counties, and more do not have than do. We also have mobile crisis, and mobile crisis may not always come out to a home. They may ask you to go to an emergency room or something like that. But there are individual programs. We have been successful through advocacy to get about $15 million of state money for walk-in centers, which are expanded. There's one in Cookeville. I won't mention them all, but Cookeville's, Hamblin County's getting one, Dayton, Tennessee. There's Knoxville, Nashville, Memphis. So that's part of our advocacy long-term, is more everyone would have access to a walk-in center, and police would have a place to take somebody where there's a crisis, instead of the choices being do nothing, jail, or emergency room. And in an emergency room, people may sit there for a while. So this is part of our longer term effort, but still just getting in the door and establishing relationships will help. And then I didn't ask the commissioner, but we are seeking, safe state funds to expand our work with law enforcement. We would like to do training in the academy, which is not CIT, but will be a precursor about mental illness. And there's a receptivity. There's a lot of interest, and we've had established new programs in recent years. We've helped in McMinnville, in Sumner County. We're talking in Williamson County, and in Sevier County, and Tipton County, and others. So there's a guide. You can let people know there's a guide to establishing a CIT program. It's on our webpage if you look under mental health and criminal justice. And we're able to work with any community that would like to look into this. And so as advocates, you can help to make that happen if you have a contact, and bring us in, and we'll come to meetings virtually or in person and help with that.
So Allison had a question. If we were begin to advocate, to whom would we speak? So Allison, as far as further training, you can talk with me. If you want to know who to advocate to, that would be your legislator. And you find your legislator on the, it's the Find Your Legislator function on the Tennessee government website, and it's also in our advocacy toolkit. Lisa, with these
By the
comments.
way, I'm from Ohio. Sorry. I'm from Ohio, and I mix up Dayton and Cleveland, so it was put in the chat. The walk-in center actually is Cleveland, not Dayton. And without advocates, it wouldn't have happened. So there's different opportunities, and Alisa would be your point person. There's some we would like you to be involved also. I hate to say this, but I will, to not overwhelm people. But if you're interested in advocacy, in addition to legislators, there's other various task forces like policy and planning, like pre-arrest diversion, like CIT. There's community groups. I know in Chattanooga that there's crisis meetings, and people from that affiliate are involved because Kathy Milam has discussed those with me. So let's start right now with legislative session. But if you're interested in advocacy, we don't want to overwhelm you. But if you want to get involved and you're not sure where or how to get involved, Alisa or I can help you to find something that's local or regional or statewide where you can get involved. We're a grassroots organization, and we count on working with volunteers.
May I ask a question?
Absolutely, Kelly.
Thank you. I always worry about HIPAA when I'm dealing with court systems, the justice system or other doctors, etc. And I'm trying to advocate for an adult who doesn't want me advocating. I'm always concerned with sharing information that could result in me breaking HIPAA. Is there any protection, or is there any certain verbiage, like just leave it to a mental health illness and not give details? Or is there a way to go about that when we're dealing even with our legislators? I mean, I know I don't have to give a name to the legislator. I can, I know how to talk with them about it, but more on a personal level when advocating.
First of all, if you want to self-disclose.
I'm sorry. My volume went down. Go ahead. I'm sorry.
It's okay. So are you talking about just as an advocate, or do you have another role like in the mental health community?
Just as an advocate, as a parent.
Okay. Oh, as a parent. So let me think through this for a minute. I believe if the individual has self-disclosed to other people their illness, it's okay. I would maybe not use their name. You can just say I'm the parent of a child with bipolar disorder, whatever it is. I think, HIPAA is when you start putting anything on Facebook or you start talking publicly. I mean, Jeff, do you have any thoughts on this?
I do.
Okay.
And it's slightly tricky. HIPAA is not the issue because you're not covered under the HIPAA regulation when you're not a provider, you're a family member, but slander laws and libel laws are still there. So if someone calls police because they're worried about a loved one and they say they threatened to kill their boss when they didn't, I'm not sure that you're totally protected. But that's only the case if you're, saying things that are untrue. Now, proving what's true or not true is not so easy. But I mean, Pete Early is a famous author, and he said he lied to get his son treatment because the police wouldn't do anything. That's controversial. We will not tell you to lie. I do think that we're not attorneys, but libel and slander laws are not exempted because there's a crisis, I wouldn't think. So if you're sticking with truth, I don't think you can get in any legal difficulty. Um, So like if you call crisis line or you call law enforcement, you want the police to come out. If you're telling the truth, I don't think that there's any legal jeopardy there that I would be aware of, nor have I
So I,
heard of any case where anybody got into any jeopardy telling the
okay, so
truth.
I can be specific with diagnoses and such. So they know what they're coming to deal with or what they're fixing to face
I
or,
think police would like to hear that so that they know if they've got somebody, a CIT officer or somebody with some mental health training, they may be more likely to get that person. And we do encourage people if there's a mental health crisis to share, and we want our police to know how to deal with that and take a little more time and use what resources are available. Now
okay,
we don't know who the law enforcement is and their level of education. Um, we've had tragedies across the country. I want to be real open and honest about it. We've heard about tragedies. We work hard to make sure those don't happen in Tennessee through our training.
yes. Okay, thank you for your answer. Thank you both.
And I do have a follow-up, Kelly. I just did a brief search. HIPAA laws
Yes.
only apply to health plans and health providers.
Okay. Okay.
I
Thank you.
can't disclose your information to outside entities.
I want to
Okay.
say one other thing. Something really important in NAMI going forward, and this is going to be over years, not weeks, is that people will be comfortable calling law enforcement when there's a mental health crisis. And part of that is we have to change our crisis system. And I'll just introduce a topic. There's no legislation this year in Tennessee, but there will be a new thing called 988, which is like 911, but it's for a mental health crisis. And it will start July 2022, so about a year and a half. And we want to be at the table to help to develop that. It'll be nationwide, but it'll be run by each state. And we will be working to try to be sure there's safe and effective crisis. So this system that has been troubling for so many, even though people try real hard, we expect will be improving.
Yes, yes. I was actually in my mind thinking about handcuffs and the statement that was made earlier, that to get them the treatment, not the handcuffs. And so trying to advocate for someone I love that's in this court system, you can't publicly get up in court and say, here's the situation. But I wanted to know if I would get in any trouble sharing that with the public defender, or, if they say, look, that's HIPAA and you're not supposed to tell me that, so I just wanted to be sure that I can share that information with officials. So thank you.
I think that here, I'll share one other thing. I'm sorry to take so much time, but diagnosis is a funny thing with mental health. It's not so precise, like you have a blood test and it's this diagnosis. So a lot of people, I've worked in the field many years, and a lot of people have one diagnosis and they go somewhere else, or a year later and they're given a different diagnosis. Many of you have heard that, but I think that it's the symptoms. They may be hearing voices. They may be out of touch with reality. They've been violent before. They've not been violent before. Those kind of things are more critical, I believe.
And I believe that would definitely sounds like the correct way to address those issues is the symptoms versus the diagnoses. When thinking of HIPAA myself, even though I realize HIPAA can be against doctors. So I think it would be wiser for us to speak in terms of the experiences they're having. Probably safer. Thank you.
Well, I'm encouraged to see that we still have 40 people on our call, even 20 minutes after we were supposed to end. This to me speaks to the interest in having a community and having community conversations. And do you all agree with that? Because I'm trying to figure out where to go from here and how to capitalize on this momentum. Certainly, we've got the rest of the sessions for the next month, but if you have any ideas or would like to continue some of these community conversations, please either put it in the chat box or you can email me. Jeff, I'm open to ideas and suggestions, and I feel like we've kind of hit on something here.
Well, I just think that signing up for our emails is important. If you don't get the e-news, which now we call NAMI at Home, there will be advocacy pieces in there. And then Alisa from time to time also does something more advocacy focused, because if we send out too many emails, people unsubscribe and then they don't get anything from us. So be sure that Alisa has your information. If you're not hooked up with an affiliate, which you may not be, then you want to be hooked up with Alisa directly. She has a policy committee and has calls from time to time. And so there's that as well. Just stay connected with us. And yes, we'd love you to join NAMI as well. But we have alerts, and there's activity different times. Sometimes it's federal and sometimes it's state. We asked people, when we were looking at Medicaid work requirements, we asked everybody to make comments. And so, just stay engaged and contact us if there's questions. And what we want to do at the state is not do all the work because we're too small. And mental illness cover impacts so many lives and communities. We want to give you tools and encouragement and resources. And if there's any challenges, questions, problems, you contact us. And Alisa's the main person for advocacy, but I'm available as well. You can email me anytime. I'll put my email in there as well. And just so glad to have you here. And please let other people know about the rest of this, because it's days on the Hill. And let's try to get other people involved and encourage your affiliate members. If you're an affiliate leader, to watch. It's hard to watch for 2 hours, but make some popcorn, have a little, comfortable chair and watch it in parts. But, it's great. And I just really am so excited that so many of you have been here today. It's part of NAMI. Advocacy is part of NAMI.
Yes, thanks again. It means a lot to me personally that you all were here. It means a lot to me as an advocacy director to see so many people willing to learn and understand how to tell their stories. We all have a story, and we need to start sharing them and making a difference in our state. So